This conference will now be recorded.
Yeah. So good evening to you all. Actually, it is the rescheduled class for medicinal chemistry. Due to some technical problem, we could not start the class in morning sessions. So today's topic is antineoplastic agents. As we discussed about antineoplastic agents in the previous class also. We talked about what is the cancer. We talked about what are the types of terminology used in anti-cancer, means used in cancer and all those. So we talked about facts and figures as per the WHO 2018 report. We talked about what are the different risk factors for the cancers. As you can see here, the cancer risk factors like obesity, low fruit or low fibrous food intake, lack of physical activity, tobacco use, then excess of alcohol consumptions, and more important is the infections from bacteria and virus. So these are the factors which aggravates or which increases the risk of cancer. So you can say risk factor also, or you can say that it is a cancer causing agent also. Virus, if it is like virus is there and if it is causing cancer, that it is also called as oncovirus. Gene involved in cancer is it is called as oncogene. So it depends on that. That different terminologies are there. Now we also discussed in previous class that the main problem or the main cause for the maximum cancer death or the death rate increase is due to the inaccessible diagnosis or late diagnosis, late treatment. People report very late, and we also came to know what is the reason, what are the factors for that. Especially this problem is more in the developed countries, more in the Asian nations, especially South Asian nations, right? And then we talked about types of carcinogens. What are the cancer causing agents like cancer causing like physical carcinogens, UV radiations, ionizing radiations, then chemical carcinogens like asbestos powder, tobacco, uh, food that are toxin which is present in food, then arsenic which is responsible for the water pollution, and it is a major, you can say the major pollutant in water, and if you are taken in beyond the limit, then it causes cancer. It is actually supposed to be free, not supposed to be taken at any even not the trace quantity should not be also present the arsenic in your water. Then we also talked about the types of biological carcinogens like virus, bacteria, parasites. We discussed what types of cancer, the common forms of cancer, your like lung cancer, breast cancer, colorectal, prostate cancer, and skin cancer, stomach cancer. These are the few among uh, several types. These are the few types which commonly occurs. Out of that, the lung cancer is the top in the list, and the main cause for the lung cancer is smoking of tobacco products or inhalation of tobacco products. Then we talked about the death due to cancer. As you can see here, the death due to cancer is maximum in case of lung cancer, right? And then we have the death due to cancer is the liver cancer or hepatocarcinoma. And the reason for that lung cancer is the tobacco products, and the main reason for liver cancer is unhealthy food habits as well as the excess alcohol consumption, correct? So you can see here the diagram, the bar diagram here, the continent wise it has been distributed, and you can see that both the cancer incidence as well as the death due to cancer is maximum in Asian and South Asian subcontinents. So this is just because of the unhygienic life, lack of proper education, lack of knowledge and accessibility of the medical treatment, the new or the recent advanced treatments yet not available in the some South Asian countries. So then we talked about the different terms of cancer in our previous class, like what is cancer, group of disease involving abnormal growth, and then we talk about difference between cancer and tumor. So all tumors are not cancerous. Tumors are nothing but just a swelling, a lump, mass, or lump of tissues that resemble swelling. So it may be cancerous, it may not be cancerous. Then we talked about malignant tumor. When tumor become malignant, it is called as cancer or cancerous tumor. Then we talked about metastasis. What is the metastasis? The metastasis is main reason, main drawbacks, or you can say the main limitations of cancer therapy. It is nothing but the ability of cancer cells to spread from its site of origination to the other parts of the body. You can say the secondary place. So due to that, what happens? Cancer spreads throughout the body, and it makes the treatment very difficult. Even during surgery also, when the surgeon remove one part, when they ampute or they remove one particular part which is affected with cancer, in the same time the cell continuously they spread, and then the another part or another section of that particular body part gets affected. So sometimes even surgery becomes very difficult. Then we also talked about necrosis and apoptosis. What is necrosis? Necrosis is nothing but the death of cells or tissue through the disease or injury. And while apoptosis is the programmed cell death or the normal routine cell death process. Then we talked about what is chemotherapy, any external chemical or reagents, compounds which is used to treat infection. It is called as chemotherapy. The term chemotherapy is mainly used for the treatment of cancer, but even for bacterial infection also the chemotherapy word can be used. So this is nothing. Chemo means chemical, therapy means treatment through chemicals, which we say as a medicine, that is called as chemotherapy. Then we talked about different types of cancers, like depending on their source. We talked about sarcoma, blastoma, lymphoma. Depending on their origin they are classified. Then what is lymphoma, leukemia, multiple myeloma? These are the types of blood cancer that we discussed. We also talked about carcinoma, which is also called as skin cancer in medical term. So then we had, I think we stopped here in previous class, right? Management of cancer. So how the cancer can be managed? So it can be managed by early diagnosis. It can be managed by avoiding risk factors. It can be managed by palliative or supportive care. And the important point was the proper treatment. So earlier diagnosis, as I said, majority of cancer death, around 22 to 26% cancer death is just due to the lack of proper diagnosis, lack of identification, or you can say that diagnosing the cancer is there, that is not getting diagnosed properly. And when it gets diagnosed, what happens? It will be too late, and in that time nothing can be done, and this leads to the more casualties. Then second one is avoiding risk factors. This is very important. When people are avoiding these factors, the two things are very, like, two things will happen. One, the chances of exposing or chances of getting that cancer will reduce. And the second thing, even after somebody has that cancer, and if they are maintaining their life very strictly, very disciplined, and they are away from those risk factors, their life expectancy increases. So remember, the cancer is something like, apart from fighting with chemotherapy, radiation, or all those other treatments, the mental and the social uh, fight is very important. The patient must get the social support, the family support, which is also called as supportive care, palliative therapy, rather than only depending on the medicines or the chemotherapy. So good atmosphere, friendly atmosphere, it gives confidence to the patient, and their body gets more immunity to fight, or the body resist against the cancer, and they live longer than the expected case. So these all things we talked in the previous class. Now today we'll talk about the cancer chemotherapy. So cancer chemotherapies are, they're also called as antineoplastic agents and or cytotoxic agents. Anti means against, neo means new, plasm means uh, growth of cell. So most of the antineoplastic agents, since they are also called as cytotoxic agent, means they inhibit or they kill the cell, and they decrease the cell growth process. You can say they will inhibit the cell division process, and the number of cell in case of cancer it will diminish. Now the problem is that we have so many antineoplastic agents are, but all of them, you can say majority of them are very toxic, and due to that, the cancer chemotherapeutic agents or the antineoplastic agents, they have a lot of adverse effects, or you can say side effects, and that the side effects are too severe. Sometimes what happens, if the patient is not strong enough, not physically strong, then he collapses due to the severe side effects of those anti-cancer drugs. I don't know, you must have seen on YouTube or in Google, or even in your society sometimes, that people having cancer, they often their teeth get deformed, that they become very bald, loss of hair, their they become very lean and thin, they lose the weight, lose the appetite. So many things are found associated with them. So these things are not only due to cancer, but also due to the chemotherapeutic agents used to treat the cancer, right? So most of the cancer anti-cancer drugs are very toxic. That's why they are also called as cytotoxic agents. Now, if as for classification is concerned, the antineoplastic agents are classified as antimetabolites. You can say the first one. Under that, very important, I have included only the important examples. Antimetabolites, the example 5-fluorouracil, methotrexate, 6-mercaptopurine, cytarabine. What these terms mean, we'll discuss later. Then another category of antineoplastic agents are alkylating agents. So busulfan is a very common, then chlorambucil, cyclophosphamide, malphalam. These are the few examples. Then microtubule inhibitors, vinblastine, vincristine, paclitaxel, and docetaxel. Antibiotics, doxorubicin, bleomycin, daunorubicin, and dactinomycin. Then we have monoclonal antibodies therapy, rituximab and trastuzumab. Then steroidal hormones antagonist, tamoxifen, a very popular anti-cancer drug, and then we have the prednisone. And apart from that, others we have imitinib, cisplatin, interferon, procarbazine, and all those. So what this classification means? So these classifications actually based on their mechanism of action of the drug. So how they work, based on that, the drugs has been categorized. For example, when we are talking about antimetabolites, so as the name indicates, anti means against, metabolite means the metabolic products. Now these antimetabolites, they act similar to the molecule nucleus or the metabolic products which is present in our body and which is required for the cell division process. For example, the base pairs, or for example, if we have one methotrexate here, let us see one example. Methotrexate, it looks similarly in a structure to folic acid. We'll discuss in we'll see next slide. Methotrexate looks like folic acid. So what happens when methotrexate is given? Cell get confused between methotrexate and folic acid, and in place of folic acid, the cell will take methotrexate, and the whole faulty cell division process, faulty DNA replication process will start, and at one point cell division will stop, and the cancer cell progression will stop after taking the methotrexate. Now remember one thing, all these anti-cancer drugs, whether it is antimetabolite, alkylating agents, microtubules, or any one category, they all follow first order kinetics. I think you know what is the difference between first order kinetics and second order kinetics. So when the effect is dose dependent. If the dose of the particular drug is maintained continuously, the cancerous cell spreading will be stopped, will be inhibited, and if the cancerous cell growth will be inhibited by these drugs, then what will happen? Those can be reduced. But the problem with this kind of treatment is that you have to take these anti-cancer drugs throughout the life. It is not like that. See, it is not like normal infection, right? Okay, I had fever, or somebody has fever, and they went to doctor, like viral infection, got that tablet or capsule or injection, or if any bacterial infection, after 3-4 days it will get cured, because there is no more further infection immediately. But that thing doesn't happen in case of cancer, because it continuously it keep going, and this is the problem, that the cancer therapy, it will be usually very long term therapy. It is not like 1 week or 1 day, and different phases are there for cancer therapy, different methods are there. So all these chemotherapeutic agents, they follow the first order kinetics. Their effect is concentration dependent. The one I told you what is antimetabolite. Similarly, we have alkylating agents. These alkylating agents, nothing but they just release one alkyl group, and that alkyl group go and bind to the DNA, and then DNA replication process will stop. Then we have microtubule inhibitors. They inhibit the formation or assembly of microtubules, and they block the cell division process. Vinblastine is a very common example. Vinblastine, vincristine, indole alkaloid. And then antibiotics, doxorubicin, bleomycin. Then we have monoclonal antibodies and other examples. So in exam, when they ask you define and classify anti-cancer drugs, so in that case, this is the ideal classification. Always write the classification of anti-cancer drugs chemical classifications, right? Don't go for pharmacological classification in medicinal chemistry. In addition, you can write, but always if the question is classify antineoplastic agents, go for the classification of this drug like antimetabolites, alkylating agents, microtubule inhibitors, antibiotics, and always give example with structures. So after this one, the next thing is limitations of cancer therapy. What happens? Why the cancer therapy is so difficult? Why cancer therapy is so difficult? Okay, why cancer therapy is so difficult? Why people are afraid of once the word they heard cancer? No, it is like the moment they start dying daily. Oh, I got cancer. Now the main problem is, as I said, first the treatment goes so very long, and second thing is it is the anti-cancer drug, chemotherapeutic agents. Their toxicity sometimes kills the patient rather than the cancer. Some patients, they are not able to cope up with those toxic effects, which we say as a adverse effect or side effects. Like the one first major limitation is the resistance to or multi-drug resistance in cancer. Then second one is toxicity. The first point under that is narrow therapeutic index. Now, my dear friends, narrow therapeutic index means the dose and the difference between the effective dose and the dose at which side effect will occur, right? It will be very less. You cannot change the dose. You cannot go for if you are going for little extra dose, the drug will exert more toxicity. So this narrow therapeutic index, it gives a very limited space, and it limits the effectiveness of the drug. Then other side effects like bone marrow depression, very common, and the people taking chemotherapeutic agent to fight cancer, their blood formation rate decreases. They get some other opportunistic infections also in between, especially they get infections in kidney, in GIT, because the blood formation is reduced, the RBC formation will be reduced, the WBC formation will be reduced, and this will lead to the another problem, another kind of infections. Then there is, you can see the myelosuppression, the ability to fight the disease will be reduced or diminished. Then there is alopecia, loss of hair, deformation of teeth. These are some other common adverse effects, or you can say better, toxic effect. But the main toxic effect is your bone marrow depression and myelosuppression. This is the two common two major thing which leads to the you can say the death of the cancer patient due to excess or due to long time treatment of an antineoplastic agents. Apart from that, it has been also observed that the patient taking anti-tumor drugs or anti-cancer drugs, chemotherapeutic agents, after some time like 10 years or 15 years of treatment, they induce or they develop some other type of cancer. This is the another one limitation of the cancer. And apart from this, the problem with cancer therapy is the metastasis. Now, as I say, metastasis is the major limitation in cancer management, and it represents the rapid spreading of cancer from its site of origin to other part. Now, just imagine if anything is localized, no problem. It can be like radiation therapy, or it can be removed by surgery. But just imagine that it is spreading from hand, it is going to head, or from like someone having cancer in brain, it is just spreading to lungs, to heart, to other kidney. Very difficult to treat, right? You cannot do surgery everywhere. All parts cannot be removed. All surgery cannot be performed on every part of the body. So due to this metastasis, the cancer control or the cancer treatment becomes very difficult, and you can say the main reason behind the failure of or eradication of cancer. Now let us come to this picture. Now this diagram, it shows or it explains the effects of chemotherapeutic agents on the growth cycle of a mammalian cell. Now you can see there are three diagrams, right? A, B, C in here. A is representing cell cycle. So cell cycle is nothing but the different phases showing the changes in cell or cell division process. So an anti-cancer agent, it may be cell cycle specific, it may not be cell cycle specific. If it is cell cycle specific, it will block a particular site or block a particular phase of cell cycle or cell division process. If it is non-cell cycle specific, it will show its effect in general. So if we are talking, I think you must have studied these cell cycle phases. The cell cycle phase has been classified into S phase, G2 phase, M phase, and G1 phase. There are four phases are there. Each phases has their own process. So for example, S phase is involving DNA replication. G2 phase is involving synthesis of cellular components required for mitosis, cell division. Then M phase is also called as a mitotic phase, where cell divides. Then G1 phase is called as a resting phase, and M phase also has one G0 phase. So G0 and G1 phase is called as resting phase in cell division process, and in G1 phase, synthesis of enzyme needed for DNA synthesis. So these are the four common phases. Now any anti-cancer drug which is cell cycle specific, those cell cycle specific drugs, they will target any one phase, and they will produce their effects. So based on the effect on the cell, the anti-cancer drugs are also classified as cell cycle specific drugs. Here you can see, and cell cycle non-specific drugs. That is, here you can see example of drugs which are not cell cycle specific. Example includes nitrosamine, cisplatin, antibiotics. Remember this example. Why? Because in MCQ sometime the question may come, which of the following is a cell cycle specific anti-cancer drug? Then at least these three examples you should remember. All antibiotics what we discussed in the previous slide, then cisplatin and nitrosourea, they affect all type of cells, rapidly dividing, slowly dividing, solid tumors, all type of malignant cells they target. While when we talk about the cell cycle specific drugs, antimetabolites, then bleomycin antibiotics, vinca alkaloids, and etoposide, they have effect for high growth fraction malignancy, or you can say if the cells are rapidly dividing, they are more effective on that. Now let us talk about the another diagram is showing the drugs and their mechanism of action. At what point those available chemotherapeutic agents are acting. Let us say 6-mercaptopurine, thioguanine. These are the purine and class of purine and pyrimidine drugs. They act by blocking the synthesis of ribonucleotides from purine and pyrimidine. You can see here purine and pyrimidine. If you just we go through the cycle, what we observe, purine and pyrimidine gives ribonucleotide, ribonucleotide gives deoxyribonucleotide, deoxyribonucleotide give DNA, DNA to RNA, RNA to protein. Right. Now this is the usual how a cancer cell develop, divide, and how it gets its energy, the biomolecules for its growth. So what happens, the drugs like 6-mercaptopurine, thioguanine, it inhibits the de novo synthesis of purine ring, it inhibits the nucleotide interconversion, and it blocks the synthesis of ribonucleotide, that RNA. Okay, there are two type of drug acts. One is your 6-mercaptopurine, another one is your thioguanine. Then when we go from ribonucleotides to deoxyribonucleotide synthesis, drugs like methotrexate and 5-fluorouracil, they play important role and they block this step. Then from deoxyribonucleotide to DNA, drug like cytarabine, which terminates DNA chain and it blocks the DNA synthesis. This chart is this diagram is very important, especially for your MCQ, multiple choice questions. Now from DNA to RNA synthesis, we have multiple drugs which blocks this phase. For example, your bleomycin, dactinomycin, then alkylating agents such as nitrosourea, cisplatin. Now one thing remember, don't get confused that one drug can have more than one mechanism of action, or one drug can block, one chemotherapeutic agent can block more than one step in this cell cycle or in this process from purine or pyrimidine base to the protein. So it is not like one drug will only block the one step. Okay, so coming to the next slide, as we see here is, one second, something. So this is the summary of your anti-cancer drugs and how they work. Let's start the normal process first. As I discussed in the previous slide in the diagram, either purine synthesis or pyrimidine synthesis process, they give ribonucleotides. Ribonucleotide gives deoxyribonucleotides. Deoxyribonucleotide, then we get DNA, DNA to RNA, then types of RNA, transRNA, messenger RNA, and ribosomal RNA, RNA to protein translation, right? And then protein to enzyme, protein to microtubules. This is how a cell division process, you can say, how a cancer cell takes its energy and how it divides. Now all these anti-drug chemotherapeutic agents, they produce their effect by blocking one or more than one path, as you can see in this case. For example, some common example, 5-fluorouracil. 5-fluorouracil, it blocks the conversion of ribonucleotides, or you can say it inhibits the TMP, thymidine monophosphate synthesis. And when TMP synthesis is inhibited, the synthesis of deoxyribonucleotide will be inhibited. Similarly, if we are talking about the alkylating agents, these alkylating agents, they give one alkyl group to DNA, they bind with DNA, and it leads to faulty generation of RNA. The RNA which is required, or which should form, actually it doesn't form. Why? Because these alkylating agents had donated one alkyl group. You can see here, form adducts with DNA. They just donate one R group, and that R group, when binds, the identity of that DNA will change, and due to that change in DNA identity, the RNA formation will not take place, or even if it is taking place, it will not be the same RNA which is required or which the cell need. So what happens, cell will not identify that one, and the whole process will stop. So it is like a kind of chain reaction. Blocking of any one process by any of these chemotherapeutic agents will block the whole process. Okay, so this is how a chemotherapeutic agents usually works. I think you must have studied in your pharmacology, or if not, you will study in details. Now let us talk, we are talking about one first category, the actual our medicinal chemistry. The first category is antimetabolites. So antimetabolites are nothing but structurally similar compounds, or you can say compound which is structurally similar to the compound which is present in cell. The first one is methotrexate. Now the question is how these antimetabolites work, or how they produce their effect. So they interfere with availability of purine or a pyrimidine nucleotide precursor, either by inhibiting their synthesis or by competing with them in DNA or RNA synthesis, right? So by these two mechanisms, these antimetabolites produce their effect. And how they are able to do so? Just because they are structurally similar, or they have close proximity in structure with the existing metabolites or existing molecules. For example, here we have folic acid which is required. You can see in the diagram. Hello, am I audible? No?
Yes,
Hello.
sir.
Yes, sir.
Yeah, fine. So we know what is folic acid, right? Folic acid is required for the cell division process, and it is an essential food, essential, you can say, a component of our food. It is needed by cell, correct? So what happens? The folic acid, either it comes through diet or it getting synthesized in our intestinal flora. It becomes folate. Now this folate, one second. This folate, it gets converted into dihydrofolate reductase. Then this process takes place. N5 N10 methylene tetrahydrofolate will form, and then this will lead to adenine, guanine, thymidine, methionine. All those the nucleobase synthesis will take place, and then this nucleobase pair, they will help in synthesis of DNA, then RNA, then protein, and other things. Now what happens when somebody takes one antimetabolite? Just think like that. Somebody takes an antimetabolite. Let us see here in example, methotrexate. Now see the structure of methotrexate. Methotrexate structure and folic acid structure almost similar, except the hydrogen of this nitrogen is replaced by methyl group, and here the carbonyl oxygen is replaced by NH2 group. Apart from these two changes, the rest of the molecule looks the same. So what happens when it goes to the cell? Just listen carefully. When it goes to the cell gets confused, and in place of taking folic acid, the cell will consume, or it will take this methotrexate. And once this methotrexate will come here in place of folate, all these chain reactions will stop. Got it? Is it very simple? Once methotrexate, if folic acid is there, this chain reaction is taking place. Formation of at the end, formation of adenine, guanine, thymidine, methionine will take place. But if there is no folic acid, and when there is methotrexate is there, the whole chain process will stop. And what will happen? There will be no base pair synthesis, there will be no DNA, no RNA, no protein synthesis, and the cell division process will block. The cell will ultimately die. This is the logic behind antimetabolites. And one example here we talked about is methotrexate. Now, when we talk about methotrexate, what is its route of administration? You can see in this diagram, methotrexate can be given by IV, it can be given by IM, it can be given by intrathecal route. I think you know what is intrathecal route, right? That beneath the skin. And methotrexate is causing it is getting excreted unchanged most of the time in urine between pH 7 or at high doses, and the metabolite which is excreted through urine is called as 7-hydroxy methotrexate. Okay, so these are the some important features of methotrexate. One example from the category, right? Now after that we'll move to the our next slide, which is the discussion what we talked. So let us summarize it or conclude this slide. What we talked about the cancer. Today we revised the introduction part. In fact, we talked about cancer, what the cancer is, what is the difference between cancer and tumor. Then we also talked about the different terms. We talked about the metastasis, we talked about apoptosis, the difference between apoptosis and necrosis. We talked about the types of anti-cancer drug. We also discussed how the anti-cancer drug works, how to cure the cancer, how to manage the cancer, what are the approaches of cancer management, and then we discussed about the classification of antineoplastic or anti-cancer drugs. Now let us discuss some questions from today's presentation. The first question is, define and classify antineoplastic agents. So if the question is this one, what is the definition? The antineoplastic agents are the drugs which used to inhibit or kill the cancer cells, or the which can inhibit the growth of the cancer cells. How to classify? You can classify antineoplastic agents as we discussed in the this slide. You can see here. Classification of antineoplastic agents. Antineoplastic agents can be classified as antimetabolites, alkylating agents, microtubule inhibitors, antibiotics, monoclonal antibodies, steroidal hormones antagonists, and miscellaneous or others. Then the next question was differentiate between apoptosis and necrosis. What is necrosis? Cell death due to injury, due to chemicals or any other harmful effect, while apoptosis is programmed cell death. Okay. Then differentiate between tumor and cancer. Tumor is nothing but a mass of tissue or lump or mass of tissue which is resembling swelling. Cancer is different. All tumor cannot be cancer, right? Then write a note on limitations of chemotherapy. What are the limitations of chemotherapy? We know the neurotherapeutic index. For these questions, we should give very specific answer. Limitations of cancer therapy. Resistance or multi-drug resistance is the one limitation. Second limitation for cancer therapy is the toxicity, their neurotherapeutic index, the bone marrow depression, alopecia, myelosuppression, and deformation of teeth. Then treatment induced tumors and metastasis. These are the limitations of cancer chemotherapy due to which the treatment of cancer becomes very difficult. Then the last question is explain antimetabolites. Write the mechanism of action of methotrexate. What is antimetabolites? What are antimetabolites? Antimetabolites are the class of compounds which resembles the compounds which is present in the cell, and they produce their effect by inhibiting the synthesis of DNA, or the inhibiting the you can say competitively inhibiting by binding with the enzymes required for the synthesis of DNA and blocking the whole cell division process. So methotrexate example, they are asking write the structure and mechanism for methotrexate. How to explain the mechanism of action of methotrexate is just methotrexate resembles structurally to folic acid. The folic acid which is involved or which is required for the synthesis of the DNA base pairs, and when methotrexate binds in place of folic acid, the synthesis of DNA base pair will be blocked, cell division process will stop, cell will die. This is the way how all antimetabolites works. The specific example here I quoted is the methotrexate. So these are the 5 questions. I will request you, I will suggest you to write the answer of these 5 questions. And see, even the previous synopsis in previous classes, previous class, I have asked the questions any people are submitting. Some of you have not submitted. So why I am giving these questions? It will be for you. It will be easy. Like after the discussion, when you are writing answer to these questions, slowly you are covering your portions also, right? And you will be answer these questions if the during your sessional exams or even during annual exams. I think for your batch there will be next time annual exams. Okay, so this is all about for today's presentation. Write the answer, short answer for all these questions, and submit to the mail. Now, morning, I think Shilpa asked about the class notes. I want to clarify to all of you that whatever I am explaining, just listen carefully. After completion of the unit 1 which I am taking, I have completed antihistamine. Now I am in this antineoplastic. After completion of this antineoplastic, you will get a proper notes as per your syllabus from me. I will give you what is required, what has been mentioned in syllabus, how much to write in the form of question and answer, so that you go through it. Don't worry for the notes, just listen the class carefully and with full attention, and tell others also to join. The another one thing I wanted to say that whenever we arrange this guest talk, whenever we